Awesome. Well, we're going to go ahead and get started. I do want to thank everyone for joining us today. Please note that this event will be recorded. So if you have any questions throughout the presentation, please use the Q&A button at the bottom of the screen, or feel free to post them in the chat. So I would like to introduce our guest speaker for today. So today's event will be facilitated by Mayra Garcia, who serves as the International Services Coordinator here at the HSC. Mayra joined Student Affairs in 2016 and has continued to serve as an amazing resource for our faculty, staff, and students. So at this time, I'm going to go ahead and hand it over to Mayra.
Well, thank you for that introduction. So what we're going to talk about today is emotional and mental health awareness for international students. And please excuse my voice. It has been a busy week since last week, so I'm trying to get back into the swing of things. Just to give you an overview, today we're going to be talking about your emotional and mental health. So no matter what country you're from, coming to the United States can be an exciting adventure. So it is normal, however, to experience challenges such as coping with academic, language, and finances, relationships, and other stressors. So in this particular presentation, we're going to be talking about this in more detail and how you can work to maintain your mental health. So you can make good decisions, build those strong relationships, and realize what your actual potential is. Just as a disclaimer, I am not a clinician. I'm not a licensed counselor, but this is in collaboration with our student health insurance, which is United Healthcare, and the Massachusetts General Hospital Center for Cross-Cultural Student Emotional Wellness. They're made up of professionals that work with international students every day to promote emotional wellness. In fact, many of these people who have worked with international students were international students themselves and have experienced some of these struggles that we're going to talk about. So a session overview. The first thing that we're going to talk about, and excuse if you can, like I said, my voice is a little raspy. Before we get started, I'd like to just give you like a roadmap of our today's discussion. So one of the things is that we'll be watching a video that introduces emotional wellness and mental health to get us thinking about the actual topic. Another thing we'll touch on is the concepts. And I'll ask you to apply your everyday emotions, thoughts, and feelings for that. And then we'll discuss common stressors, what you've already experienced or what you think an international student might face. And when we watch a video of 11 international students discussing their biggest challenges about adjusting to the US, we want to talk about how they work to overcome these difficulties and what you thought about that. And then at the end, we'll give you a basis of discussion on how to manage these particular emotions and wellness, as well as where you can seek help. See if I can move my slide. Okay, so here is the video that I was talking to you about. Let's go ahead and watch.
Did you know that almost half of all young adults have had some type of mental health disorder in their lives? And while mental health problems can affect people of all ages, races, genders, and backgrounds, college is a particularly susceptible period. Fortunately, there are many support services to help young people through these challenging times. In this short video, we'll discuss the signs of mental health problems and how to seek treatment for them. Then, we'll dispel some common myths that prevent people from seeking help. But first, let's discuss what mental health is. Mental health is a person's emotional and psychological well-being. It affects how we think, feel, and act, and influences how we make decisions, how we engage with others, how we perform in school, and how we deal with stress. Mental health problems can come in many forms and can often be brought on by stressful situations, like moving to a new country, being away from family and a familiar culture, or worrying about school exams. It's not uncommon for new students in the United States to struggle adjusting to all of these changes at once. Often, people struggle with mental illness because they aren't aware of what it is. A few common warning signs to watch for include feeling helpless or hopeless, Having mood swings where you are extremely happy one moment and sad the next. Feeling sad and lonely for a long period of time and the feeling doesn't go away. Having low energy and little or no desire to engage with others. Eating or sleeping too much or too little. Smoking or drinking to excess or using drugs. Seeing or hearing things that don't exist. In some cases, it can even come in the form of wanting to harm yourself or others. If you or someone you know experiences these symptoms, you should seek help as soon as you can. Help for mental illness is often referred to as counseling. And getting help for a mental health condition early is very important. The longer you wait, the more difficult it can be to manage. If you or someone you know has a mental health condition, there are many places in the United States to get help. The best place to start is your on-campus counseling center. Campus counseling centers are often nearby and convenient. Their services are confidential and typically free or offered at a reduced rate. If your school doesn't have a counseling center, you can contact your insurance company to locate a nearby provider. You can also contact a therapist, psychologist, or psychiatrist directly. All are professionals trained to help you deal with mental health issues you may face while studying in the U.S. Or you can call one of the confidential toll-free services highlighted at the end of this video. There are many myths about mental health and seeking help. Here are a few of the most common. Counseling is for crazy people. False. Millions of people in the U.S. get counseling, and studies show that most people who get help with a mental health problem improve dramatically or recover completely. In fact, seeking mental health care shows that you are motivated, self-aware, and empowered. Everyone will know I saw a counselor. False. In the United States, there are laws and professional ethics standards that prevent your doctor from disclosing information to your parents, friends, and school faculty. I can handle my own mental health problems. If I can't, that means I'm weak. False. Seeking help for a mental health issue is similar to seeking help for any other medical problem. If you broke your leg, you wouldn't try to heal yourself. Mental health is no different. If I talk about drinking alcohol or doing drugs, I'll get in trouble. False. Mental health professionals are available to help you through a difficult time, and their offices are considered a safe place to discuss your experiences and what you are going through. The things we discuss will become part of my permanent record and will be viewed negatively. False. The information you share with your counselor or other professional will remain confidential. It will not be a part of your school transcripts or any other school records. In summary, many students experience mental health challenges while in college. Professionals are ready to help you through frustrations, fears, and other obstacles you might face while studying overseas. If you or someone you know needs help, please see a mental health counselor or contact the following hotlines, which are toll-free and completely confidential.
Right, so being an international student, depending on where you're from, mental health may not be commonly discussed back home, and there may be some stigma surrounding it. So this video explores some important topics when it comes to mental health. In the beginning of the video, we learned that almost half of people in the United States struggle with mental health disorder by the time that they reach 18 years old. So this has led to more and more students here in the U.S. taking much more openly about their everyday struggles, about anxiety, depression, and other mental health issues. So as you heard, in college in particular, when many students in the U.S. go from home to study, just like an international student, they're facing additional pressures and learning how to balance life all by themselves for the first time. And this can be stressful as they can have to balance finances, loneliness, responsibility, academic pressure, and they're in a new environment with no established routine. Does any of this sound familiar to anyone? All right, well, let's continue to build on this, and then we will cover some mental health topics and talk more broadly about emotional health. and the range of emotions, thoughts, and feelings we experience on a daily basis. Okay, so we all work to maintain our emotional and mental health. Okay, but we are human and we experience a number of different feelings. And it's normal to feel a range of emotions throughout the day. You may wake up happy, feel stressed about the things you need to get done, and sad if you hear bad news. When you wake up happy, if you wake up happy, feel stressed about things you need to get done, sad if you hear bad news, and energized when you're talking to friends. So it's important to check in with yourself on a regular basis to see how you're feeling. Doing this will make you manage your emotional health, which will impact your overall quality of life, not just here at school, but even in your professional and personal lives. Okay, and so this chart kind of gives an overview of the field of range of emotions that you could be feeling in one particular day. Go to the next slide. So speaking of feelings, so this is thoughts and emotions triangle that we're going to take a look at. So it may come as no surprise that our emotions influence the way we think and the way we behave. There's a triangle that illustrates that our thoughts, emotions, and behaviors are all interconnected. If you're feeling lousy, it can cause you to have negative thoughts, which can also cause you to have negative behavior. But if you learn how to use this triangle effectively, you can turn a negative into a positive and change your behavior and thoughts so that they can become more positive as well. So for instance, if I have to give a presentation tomorrow, you start feeling anxious or nervous. You start thinking, I'm never going to get ready to give this presentation. I may not be prepared since it seems hopeless. That could be a behavior. Or this may be challenge. I'll need to prepare early so I can be ready. To prepare in advance could be a behavior that you can change that trait to. So that way you can actually be prepared for that presentation. Positive reinforcement is that you could be proud and motivated. So the next thing that we are going to cover is what are some of the stressors that international students face while studying and living in the U.S. Does anybody want to volunteer to read the list?
I can read the list. I don't think our guests can actually use their mics. So some of the common stressors are new academic systems, family pressure, homesickness, loneliness, lack of community, new foods, language exhaustion / barriers, differences in culture / tradition, becoming independent, finances / scholarship, climate changes, relationship stress, pressure to success.
Thank you, Lauren. So as you can see, that the negative emotion and thought that you initially had caused yourself as a behavior to be a loss of constructive and perhaps even damaging to your emotional wellness. But when we're forced to think positively, the outcome is much more constructive. While your emotions are the hardest thing to change, you can reverse this spiral by changing your thoughts or behavior to get out of the downward spiral. Okay, and so that's what these common stressors are where they're pinpointing. So speaking of stressful situations, an international student has an adjustment period when they come to the U.S. And in particular, stressful to deal with communicating in another language, missing the taste of home, adjusting to a new academic system, and just being away from friends and family. All of these other stressors are not necessarily a bad thing. Just take a look at the graph on the side. As you can see, some stressors can motivate you and enhance your overall performance. For example, if you feel stressed about your English, but then you spend time trying to improve your language skills, and ultimately you become a quicker learner. Others might need to perform well on tests because their parents are very involved in their academics, or because they need to maintain a scholarship. Now, these are all great motivators. We just need to be mindful when the level of stress is too much. Eventually, stress has a tipping point. And as you can see on the graph, where too much stress will negatively affect performance, which can make you feel burnt out. At this point, you feel overwhelmed, anxious, and depressed, and just hopeless. So when this happens, you may tend to focus more on negative thoughts and feelings, resulting in a downward cycle. That's why it's important to realize the signs of having too much stress and figure out ways to cope before it becomes too much. I'm having technical difficulties. Here we go. The up and downs. Many students experience the up and downs when it comes to a country, often referred to as cultural shock. Just like in this graph, the stress levels of your emotions, emotional health, and constantly changing, going through ups and downs, it's very common. This is more common when we talk about moving to and living in a new country. There is often an adjustment period of getting used to a new environment. As I said, it's commonly referred to as culture shock. So, and culture shock affects people living from home and can impact people differently at different times too. You might arrive to the US and be so excited to learn about new foods, new culture, new people, but maybe a few months from now, you might get tired of these things. You might miss the food back at home. You'll feel like your friends and your family are so far away, or you're just tired of feeling misunderstood. So this culture shock can affect us in all different ways, from easily being frustrated, not wanting to go out, not wanting to make friends, being sad, being lonely, or even depressed. While this is completely normal, it typically fades as you adjust and begin to feel more comfortable in your new settings. But sometimes it may not be so easy. It may require for you to reach out for help. So what we're going to do is we're going to watch another video. And this is about a 10-minute video where students from different countries are going to talk about their struggles coming to the US. You will hear how they handled their stress and how culture shock, and they will conclude with their advice for future international students. So let's take a look.
Shocking and something new that I know most of the Americans are used to that because they start working in high school. But for me, that I never studied and worked at the same time, that was shocking.
In the US, the hardest thing is to find friends.
Yeah, making friends in the US has not been easy. I think because you have kind of like clusters of people in the US. We have the white Americans, you have the Native Americans, you have the Black Americans, you have the Hispanic Americans, you have all these groups. And then when you come from Africa, you can't fit in any of that group, any of those groups.
At the beginning, of course, the language, when I say language, it's not only about you talk to people, you listen to people. It's also like just a normal life. You go to Walmart, you want to buy the stuff you want, but you see all the tags, they're all English. And when you go to the cashier asks you credit or debit. You don't understand. We never learned that in China. Like we learn English for a long time, but we never know they're gonna ask you credit or debit. We don't even know what is that.
Making friends is different. Dealing with people is different. It's not wrong or right, it's just different. But yeah, I believe this was a kind of cultural shock.
The biggest challenge that I feel or like faced moving to the US was to feel kind of like lonely. Despite the fact that you have friends here, it's not as the same as back home. Back home, I'm from a big family, so I'm used to have people all over the place always, and I have a lot of friends there too. So moving to the United States, it's kind of like tricky because you have to start again.
My number one stress as an international student would be keeping my scholarship, because I am here on a scholarship which enables me to pay the in-state tuition instead of the international tuition. So my number one concern and stress is to do well in my classes and to ace it and to keep my scholarship.
I deal with stress in the US. I have to look for resources. Like I started like swimming. I started to do like more sports things. I started to get involved with the university too. I tried to get more in groups of conversation groups and like try to meet people and just be active.
I have my husband that I talk to a lot. I go to church. So again, having just the spiritual input. I go to the gym a lot. You see, I do a lot of gymming just to get my dopamine up and to feel good about myself. Yeah, so those are some of the ways that I deal with stress.
I think it's definitely necessary to have balance and know yourself, what helps you release the stress. So even though I know I have a lot to do, I take breaks if I required to. Yeah, I just watch a movie, watch a TV show, go camping with your friends, go out, walk around. It just, if you need a break, you need a break, and just take it as long as you want. Otherwise, you won't do it good.
The biggest culture shock is like, as I said before, is finding friends. So how I cope with it, I am very, very lucky to be able to live on campus. Since I'm living on campus, I have like hallmates, I have like, how to say, advisors that they, if I have any difficulties, just talk to me. And I talk to them, and then they told me, here's some events that you can go to, here's some activities that you can do, so you can meet friends and stuff like that and talk to new people. And I think how I cope with it is I finally made myself ask for help. Talking to your parents, talking to your family, talking to friends from your country have helped you a lot for the homesick, for this culture shock. But eventually, what you need to do is still, like I said, just to cross the comfort zone, make American friends, experience American culture, like by yourself. What we did, we just walk on the street and go to the stores and talk to the clerks. And even though, I mean, the reason we do that because normally they are very friendly. They won't judge they kind of really friendly and welcome you to come to the United States, and they will answer your questions.
Being a graduate student, yes, I do stress out a lot. And if I'm stressed out, usually what I do is I just go to sleep because I don't find any other solution to that except sleeping. But sometimes I do visit the Student Health and Counseling Center at my university, and they do provide a good counseling. And yeah, that helps me a lot to get relief from my stress.
The counseling center was very helpful because I was able to vent. My first year in America was a nightmare. There are many times I just wanted to go back home, you know? And I just went there. I think I was going there every week. And this counselor was very pleasant. She listened to me. She heard me. She helped me a lot.
I went to the counseling services here at my university a couple of times, and they're pretty easy to communicate. They are like, although I believe that they still do not fully understand the cultural differences. I think that they are the best people to go to because they at least know that there exists a difference and they should work it out in some way.
I got pretty depressed when I came here at first. So I heard that a lot of people here, they go to psychologists or psychiatrists like to have psychological, how to say, treatment. So in Indonesia, it's pretty expensive to like just go to the doctor and talk about it. But here, I got an insurance for students. So when I go to the health department, they just told me, oh, yeah, you can register for this. And we have like this time, so you can come anytime you want to go. So it's easier here and it's more accessible for students.
I would suggest them to stay on campus for about a year and have an American roommate so that you can get to know more about the American culture and how to like behave with an American, or like what you should do. Like suppose my roommate told me that how's it going is a term which is used to say how are you. I didn't know that before. My roommate was the one who taught me.
So there are a lot of sources you just take advantage of, like the Global Education Office. There are a lot of organizations that help you, offer you help. So just be brave and encourage yourself, and you can get through that.
So for the students who are like adjusting to the cultural shock, I'll tell them make friends, no matter from where, whoever is friendly, just be friendly and make friends, go out, have parties, like whatever will make you feel comfortable being here. Do it just to see what are the benefits of being here, and you'll adjust your concentration ability.
The most important is to practice your English. That's the basic ability. And the second one, I hope the students from China, if they want to study here, should always remember their initial reason why they came here.
Put yourself out there, they'll, give that friendliness back to you. And I think that's the key to remember is whatever you put in is what you get back. And at first it was really hard to see that was true because I didn't really feel like people, some like wanted to talk to me, but if you talk to them, they'll talk to you. And I think that was the most important part. But I would recommend to be open, to be flexible, to have your family, your own countries close to you when you need them, and to also find the resources to be able to do your work here in the US.
Like I see a lot of people from all around the world here, from Asia, from Africa, from Europe, from America, but I can compete with them. And like after I overcome my shyness, my awkwardness, turns out as long as I'm confident, I have like skills that I can contribute here. So knowing that is like really empowering for my life.
So now that we've watched the video, I want to see if I can get your feedback. For anybody who's on the line, was there something that was said by one of the students that you really identified with? I don't know if they have the option to unmute.
They can unmute, but if you guys would like to post anything in the chat, you should be able to utilize that.
Okay. I'm able to see the chat, Lauren, only because if I open it, it'll pop up in.
Oh, no, you're okay. My Sophia and I will look and see if anything comes through. So far, we haven't seen anything yet.
All right. Well, we can move on. I know we have a time restraint, so we can always come and discuss that further. So managing your emotional health. Some tips is to make time for yourself and take breaks, reach out for help, find your balance, academic, social, and physical activities. Stay in touch with family and friends, and take care of your body. Eat right, exercise, try to get at least 8 hours of sleep, and create a community where you can get involved. The best advice is from those international students who have been in the same shoes and are here in a number of ways. These students manage their emotion and mental health. So there was a lot of great tips for making time for yourself, taking breaks, and to staying in touch with friends and family. Based on that last video that we watched. So, and a number of students mentioned that it was going to the counseling center that helped them a lot. So you may be asking yourself, how did they know that they should go to the counseling center? Okay. So here are some specific items on when to try to seek help. And it's just a few signs and symptoms of high stress when the level of stress you're experiencing is too much to handle. The change in appetite or sleep, easily irritated, frustrated, or moody. Problems interacting with professors, advisors, or others, having problems adjusting to academics, difficulties in making friends or getting along with roommates, having low energy or avoiding others, feeling lonely, hopeless, or bad about yourself, increased use of drugs or alcohol, and thought of suicide and harm to others. All of these signs that the stress is beginning to build up and that it might be too much. If you remember the graph from the earlier slide, we also referred to it as being burned out. When you are feeling this way, it's time to ask for help. So there's some common myth scenarios, activities that I won't go through all of them because I want to make sure that we have enough time to have a discussion at the end. But just some scenarios that you can think of is, can I handle my own mental health problems? If I can't, does that mean that I'm weak? Okay. Counseling is for crazy people. Only someone from your home country will understand my problem. I could lose my visa status. Everyone will know that I saw a counselor. Okay, so those are just common myths that typically we hear from international students when we're discussing issues about their emotional feelings or their mental health. Okay, just to go over one of the actual scenarios. Sai has been having trouble adjusting to life in the US, making friends. While the people in his classroom are nice, he doesn't seem to connect with them in the same way he did with his friends back home. This has left Sai feeling very sad, and he begins to spend most of his time in his room. Someone recommends the counseling center to him, but he thinks that only people with real problems go there, and he doesn't think his problems are a big deal. Okay. So do you agree or disagree with this notion? Anybody want to add to that? So people go to counselors for all sorts of reasons, from feeling sad, dealing with relationships, or even getting help academically. These people are trained to listen, offer various resources, and also give strategies to cope with those challenges of every day. So not just crazy people go to see counselors, right? They're dealing with real problems that can help you assess and deal with those actual emotions. So it is very helpful to try to reach out if you feel that you're getting overwhelmed. And myth number 2, Ingrid is fascinated with American culture and has always thought that there was a number of similarities between the US and her home country since they share the same Western culture. However, Ingrid is finding that there are many more differences than she originally thought. She feels that people are not genuine, and she doesn't understand why people make promises that they don't intend to keep. She also finds that particularly and directness is insulting to others. Ingrid would like to speak to someone about this, but feels that an American counselor wouldn't understand where she's coming from. Anybody have any thoughts on that? What I'd like to add is, though, although Ingrid might feel that someone from her own country could understand, most counselors have had culture sensitivity training that allows them to work effectively with people from different countries. While someone may not always understand your specific circumstances, they do not have the tools and the training to help. You can always educate your counselor about specific aspects of your background that they may not know at first, to better help them understand where you're coming from. So this particular slide, I think, is very important. This is where to go. If you're actually having a hard time adjusting, if you're not feeling like yourself, if you need someone to talk to, or if you just need help to reconnect. There are resources here on campus that we provide, resources that are accessible at your fingertip that we can refer you to. One of them being the counseling center. We don't actually have one here on campus yet, but it is being worked on, and it will be open within a few months based on the information that was given to me by the Student Health Clinic. But in the meantime, while that's being open, if you have our student health insurance, you can utilize our Healthiest You services, which is a virtual counseling service. And this is virtually a free service that's available if you have our student health insurance. There's also what the actual therapist and counselor is. So they're a clinician that holds a master's degree or higher in the field as a state license but cannot prescribe medication. Often, but not always, called a psychologist, therapist, or counselor, even a social worker or clinician. We also offer a free service with our My SSP application, which I can provide you a flyer in this presentation just to get more detailed information. But the overgeneralization is it's free, it's confidential. They can provide services 24/7 in real time, and they provide a chat option, and it's multilingual. So if you're not comfortable with just speaking in English and you want to speak in your own language, they provide that service, and they will connect you with a professional counselor. We also have a psychiatrist here on campus who is Dr. Winters, who is located in our student health clinic, who takes appointments, and you don't have to necessarily have our student health insurance. He does take outside insurance that's not related to the school. Or you can make an appointment with our student health coordinator to provide you the benefits and the coverage dates for your student health insurance, and where you can access a psychiatrist that is covered within our network. So they provide those services for free as well. And last but not least, our Office of Care and Civility. They care about our well-being of our students, not just academically, but also emotionally and physically, and they provide services across campus that respond to the students' unique health and wellness. And they'll be able to provide you more detailed information about the care team. I don't know if I want to put you on the spot, Lauren, but if you want to give them a brief overview of what the care team does.
Sure. So our care team is a group of amazing individuals who there's representatives all across campus, but you will definitely find some in the Office of Care and Civility. And if you would like to schedule a meeting with them just to talk through anything that might be impacting your performance inside or outside of the classroom, they're an amazing resource to connect to, and you can schedule that meeting through Simplicity. I'll see if I can drop the link in the chat, but for those of you who are watching, if you go to the UNT HSC website and go to the Google search, you should be able to just input Simplicity with a Y, not an I, and it will pull up the login information for you.
Thank you for that. And that's at a local level on where you can get some actual resources on where you can go. But at a national level, as far as additional resources, we do always have the suicide prevention hotline. We have the Trevor Project, and other useful crisis hotlines that you can contact to get various help. If you're feeling a particular overly overwhelmed, burned out, or if there's just somebody who just you want to talk to. And it doesn't matter. Don't ever feel that any of your issues are minute. Your feelings are valid. And so there is someone that you can always reach out, whether it's here on the university campus or if it's these specific hotlines that you'd like to reach out to. And I can provide the resources and the flyers to our OCC department, and they can provide that information to everyone in the chat who would like that information or whoever attended the presentation. But I can open the floor if anybody has any questions or any concerns. If you saw anything in the chat, Lauren, that anybody had a question on.
We didn't see any questions come through, but Alex Cooper was able to share the Simplicity link in the chat along with the OCC Care Team website information. So if you guys are interested in learning more about that, I would say check out the chat because those links are available there.
Well, I will take that as there's any further questions, but you are always welcome to reach out to International Services here on campus, to the Office of OCC if there's any concerns, and thank you for coming.
Yes, thank you so much, Myra. And I just want to echo what she said. Thank you for attending the session today. We really appreciate it. If you'll look at the chat, for those of you who are joining us today, you'll see that there is a comment about all students who attended will be entered into a drawing for a giveaway item. The winner will be contacted via email, their HSC email, so be on the lookout for that. And then also, this is part of our Be Well Week event schedule. So if you're interested in attending more events with us, we have some that are going to be in person, some more that are going to be recorded via Zoom, and then we also have some on-demand programming. So lots of options. But if you're interested in attending any of those, please click the link there. You can also find that information on our HSC Engage page. And then we also would love it if you guys would fill out the feedback form so that we can continue to provide you guys events and initiatives around the resources you guys are saying that you need. So again, thank you for joining us today, and we'll hang back if anybody has any questions.